Are you confused while filling the MRCOG Assessment of Training form? Not sure what to write in training post? Confused about signatures, competencies, gaps in training, or supporting documents? Then this video is exactly for you. Hi everyone, I am Dr. Sana Ansari and today I'll be answering the most common queries doctors face while filling Assessment of Training form for MRCOG. This is one of the most stressful part of the process because even small mistakes can delay your application. So in this video, we'll discuss how to fill the form correctly, some common mistakes, what supporting documents are needed, and practical tips to avoid delays or confusion. So let's clarify everything step by step. First, let's understand what this form actually is. The assessment of training form is basically used to evaluate your previous obs and gynae training experience. RCOG wants to understand where you trained, how long you trained, what level of responsibility you had, and whether your training is equivalent to the required standard. This is why accuracy is extremely important. Please remember, this is not just a simple biodata form, it's an official training evaluation document. Now let's come to the most common queries asked. One of the biggest question candidates ask is how should I mention my training post? So you have to enter each post separately and chronologically. For every post, clearly mention hospital name, department, designation, start date, and end date. Full time or part time status. For example, you did a junior residency, so you write as junior resident in Obs and Gynae, XYZ Medical College, from this date to this date. So July 2021 to July 2024. Don't combine multiple postings into one line. Another important thing, dates should match exactly with your experience certificate. If your experience certificate says July 2021, don't write it as August 2021. This creates unnecessary confusion. Now, the second query, what if I have gaps in training? Please don't panic, gaps are not always a problem, but they should be explainable. For example, if you took maternity leave, exam preparation, health reasons, relocation, or research work, the important thing is honesty and consistency. Do not try to hide gaps by changing dates. Now, another query related to supervisor signature. This is probably the most asked topic. Candidates often ask who should sign the form, can previous consultant sign, is hospital stamp necessary, can digital signatures be used. So, ideally, supervising consultant or authorized training head should sign your form. Signatures should include name, designation, hospital or institution details. Institution stamp is always helpful whenever possible. Another important point, do not paste copied signature digitally from other documents. Everything should be authentic and verifiable. Now let's discuss the supporting documents. Your assessment of training form should match your evidence. And these include training completion certificate, experience certificate, and appointment letters. Also, competency assessments. Many candidates make the mistake of submitting the form without adequate evidence. Remember, if you mention training in the form, you should ideally have documents supporting it. Now let's discuss the mistakes that commonly delay application. Date mismatch. The form and certificate should match the dates. Missing signatures. Unsigned forms may be returned. Then incomplete training details. Do not leave important sections blank. Poor quality scans. Blurry uploads create delays. Then wrong chronology. Training post should be arranged correctly. Different name spelling. Ensure consistency across all documents. So here are my practical tips. Number one, create one folder for all documents. Number two, rename files professionally. Then third tip, cross-check every date. Read every section twice before submitting. And last, keep both soft copies and printed copies safely stored. Most importantly, start collecting signatures and certificates early. Many candidates struggle later because candidates get transferred or hospital records become difficult to access. And please note, this video is based on common candidate experiences and general guidance regarding assessment of training form. Requirements and processes may change over time. Always refer to the latest official RCOG guidance before submission. I hope this video helped clarify your doubts regarding MRCOG assessment of training form. If you still have questions, comment them below. I'll create a part 2 answering real candidate queries. If this video was helpful, like, share with your colleagues and subscribe for more MRCOG guidance. Thank you for watching. I'll see you in the next video.